the COVID-19 epidemic on Mobile County. We'll get right to the Mobile numbers since our Monday report contains more information than normal. So this morning we're reporting on 2,743 cases of COVID-19 in Mobile County residents. That was an increase of 26 added yesterday. So over the weekend, on Friday, we added 45 patients, on Saturday 34, and on Sunday 26. Most of those, all but 19, are laboratory confirmed. We've had 263 COVID patients with hospitalization. That's again hovering just under 10%. And we're holding steady at 129 patients who died with COVID-19 disease. We didn't add any more deaths over the weekend, which is good news. When you look at the numbers of reports daily, it jumped around greatly. So what we like to do instead is take a look at some of the smoothing effects by looking at a 7-day average number of cases added, or a 14-day number of cases added, or just by looking at it by week, you can get a lot more idea about if it's going up or if it's going down. So one of the things that we added to the report this week is on figure 2. This is on page 3, showing the number of cases reported by week. I've split this out by those that are associated with outbreaks in long-term care facilities and those that are not. So the blue bars represents the cases that occurred as a result of community transmission. So just the normal transmission outside of these outbreaks in congregate settings that we've seen. And you can see that early on we had about 15% of our cases were associated with long-term care facility. And as the long-term care facilities have begun doing much better and recovering from their outbreaks, and we have fewer facilities impacted, you're starting to see that number is reducing really nicely, and more of our cases are associated with community transmission. So we are continuing to see a rise in the number of cases transmitted through community transmission or through person-to-person contact out and about in other locations besides the outbreaks that we know are happening in a couple of long-term care facilities. Our 7 and 14-day average went down slightly last week, but again, some of that is based on comparison with weeks ago when we had more things coming out of the outbreaks. So I do want to emphasize that we still are seeing a slow but steady increase in the number of cases reported through community transmission. So at the last calculation, this has stayed the same. About 60% of our COVID patients are presumed recovered. Someone asked me a couple days ago about asymptomatic infection, and it's not in this report, but we see asymptomatic infection or people who have already recovered from their infection. Those two things are really hard to separate, but around 20% of the interviews that we conduct, the case patients are no longer symptomatic or do not have symptoms. So let's see, again, as we see recovery from outbreaks that were experienced, that were going on in our congregate settings, we will see the number of cases associated with those long-term care facilities go down. At some point it was as high as 23, 24, 25%, and now it's down around 21%. So we are seeing that number go down as we would expect it to do. The good news, as we reported last week, is the number of hospitalizations that occur each week is going down, and it has gone down steadily for many weeks now, as have the number of COVID deaths reported by week. The week ending June 13th, so this past Saturday, those 7 days we only added 3 COVID deaths. And then on the last page of the report, we show some trends in the number of laboratory tests that are conducted, both the positive laboratory results and the negative laboratory results. We still are seeing around 9% of our total laboratory results that are positive for COVID. But what I was disappointed to see is that the overall number of laboratory tests performed last week was nearly half of what it was the week before. So we continue to emphasize that we need Mobile County residents to continue seeking testing for COVID-19 disease. If you have been, if you think that you've been exposed to someone with COVID, or you are contacted by public health that you have been exposed to someone who's contacted, please get tested for COVID. Young, healthy people will have a very mild illness, but we still need you to get tested now that we have testing materials available. You can contact the Mobile County Health Department at 690-8889 to get a COVID test at no cost to you at one of our 8 or 9 testing facilities around the county. So please, we need to keep testing about 2% of our population every month so that we have the information that we need to really track the outbreak. So we could use your help in keeping those testing numbers up. All right, this graph just shows what I was trying to say. Yes, there have been really dramatic increases in the number of cases reported statewide. The Alabama Department of Public Health has reported more than 2,000 cases since Friday. Our cases have continued to rise, but not at the dramatic clip that the ADPH is reporting. There are other geographic areas outside of Mobile County and Jefferson County that are really struggling with being able to control the community transmission there. Montgomery County now is reporting more cases of COVID-19 disease than Mobile County, with, of course, a much smaller population and a much smaller footprint with regard to the healthcare facilities there. So we are sending out our thoughts for what they're going through now, because we've been there and we don't want to go back there again. So again, it really depends on you complying with the amended safer at home order, practicing social distancing, wearing your face coverings when you're about town, staying at home when you're sick, and again, we want to make sure that people continue to get tested who need to be tested or want to be tested. I just want to read some comments from the Centers for Disease Control that came out over the weekend, which really emphasizes that we are not out of the first wave yet. Lots of people ask me, are we getting close to the second wave? It's like, I don't even think we're out of the first wave yet. So when I saw these comments from CDC, it really helped assure me that my interpretation of what's happening was in line. So the number of COVID-19 being reported in the United States is rising quickly. The increase is expected given an increase in testing and ongoing rapid spread of disease across communities in the United States. While these numbers are concerning, the increase is not unexpected. More robust data will allow CDC to better understand and track the size and scope of the outbreak and strengthen prevention and response efforts. The U.S. nationally is currently in the accelerated phase of the epidemic. Duration and severity of each phase can vary depending on the characteristics of the virus and the public health response. So again, nationally, we are still in an accelerated phase of the pandemic. So we are probably not over our first wave. We still are seeing an increase in cases in Mobile County and across the state of Alabama. There are other states that are experiencing rapid increases in cases. So we are still advising you to, only travel if it's absolutely essential to other parts of the U.S. and abroad, because there are communities that are in much worse shape than we are in right this minute. But that can change so quickly. So we continue to keep an eye on the numbers to see, and the trends to see if we need to further restrict or if we can further loosen the amended safer at home order. And so look to the state health officer and the governor to make some decisions on that. The current order, as you know, expires July 3rd. But with the unprecedented rise in the number of cases throughout the state this week, I think they would be hard pressed to further relax restrictions. All right, here are some questions. Let's see. So we get this a lot, this sort of theory that everyone who gets sick or dies during this time is classified as having COVID, even if they don't have it, which that is not true, and that viruses aren't really living things, but that also is not true. Viruses are very much alive, and this is, the proof of this is that it replicates within humans, which is how it causes illness. And so, dead things don't replicate. So let's just see what's next on my list here. So also some, rumor mill or conspiracy theory that everything that the Centers for Disease Control and Prevention has said in the beginning was all wrong. It is true that we have learned a lot about some assumptions we made in the early days about how coronavirus might act. And in the beginning, we always said, based on the science that we have now, this is what we think, and we will, change our guidance as we learn more. Again, this was a novel coronavirus that no scientist had ever seen before it showed up in Wuhan, China, when it jumped from an animal. So yes, we did not know everything about this virus in the beginning. We still do not know everything, and things will continue to change as we learn more about the science and biology of this unprecedented novel coronavirus that no one had ever seen before. Let's see. Thank you for clarifying the requirement for child care workers to wear face masks. Do you know if the same is required for children at summer camps? So here is the amended order. Again, it's online, but I will read you what it says on summer camps when it regards facial coverings. So day and overnight youth camps shall comply with the following rules: social distancing. Employees shall not knowingly allow campers or guests to congregate within 6 feet. Employees shall not knowingly allow campers or guests to participate in athletic activities in violation of paragraph 10 of this order. Sanitation, camps shall take reasonable steps to regularly disinfect frequently used items and surfaces. And for facial coverings, employees shall, to the greatest extent practical, wear a mask or other facial covering that covers his or her nostrils and mouth at all times when in regular interaction with campers and guests. So that is directly out of the order. And also there is a guidelines for day and overnight youth summer camps one-pager that's available on our website and also on the ADPH website. Here's somebody asking about some rare symptoms of COVID disease called COVID rashes and COVID toes, that they haven't seen any reporting on this from Mobile. So in Alabama, well, first of all, although those have been reportedly associated with COVID-19 disease, COVID rashes and COVID toes, I know toes is not currently on the list of symptoms from CDC, and I don't think rashes are either, but I'll take a look at that. And right now, because it's a rather rare and not really understood how frequently it happens, it's not something that our state surveillance system can capture. So we currently don't ask about COVID toes. But if CDC sees a reason to collect this information and makes that a part of the list of symptoms, signs and symptoms, then we will certainly begin collecting that information. So let's see 2 other things here from the media. With the spike in numbers, are we concerned that people are not taking the pandemic serious anymore? Yes, I am very concerned at the apparent apathy for the seriousness of the COVID pandemic. We are not out of the woods. We are not going to be out of the woods for months and maybe years. So we need you to continue wearing your cloth facial covering, and we need you to continue social distancing to protect yourself from community transmission. Sorry, I'm just getting to the symptoms. So rash and COVID toes are still not on the list of symptoms according to the Centers for Disease Control. So we'll keep an eye on that. So I just want to remind you about wearing your facial covering. I have this nifty one that my agency gave me so I can share my Mobile County Health Department pride. But remember, when you're out and about, try to keep your hands off of your mask. So it needs to cover your nose and go underneath your chin. And then when you're wearing it, try not to touch it. and wear it when you're out in the community or when you're around someone who's not in your immediate household, but you still need to maintain that 6-foot distance. And then when you get home, just try to take it off by the ear straps, right? And not touch it, and then, throw it in the washing machine or hand wash it and let it dry. If you put it in the dryer, just try to put it in the highest heat possible. If you're not going to dry it, then just lay it out and let it air dry. It should be okay there. All right, so just the last couple of thoughts. Someone saying that CNN's reporting that President Trump is planning a visit to Mobile in July to give a speech maybe at Lad Peoples Stadium. I've not heard that, but again, as long as the state health order is adhered to, there shouldn't be any problems with that. And I don't know what time in July. It could be that the order, the current order extends or expires July 3rd. So we may have different orders in place. So as long as they are complying with the state health officer order, then there's no reason to have any concern about that. But again, large gatherings are prime ground for COVID transmission. So be careful out there. Stay safe. Do your part to protect yourself and your community. And we'll talk to you again tomorrow.